Hello and welcome to our channel. Today we're delving into a topic that's causing waves in the healthcare industry, the rise of artificial intelligence and its potential to replace pharmacists. As technology continues to advance at a rapid pace, AI is becoming increasingly sophisticated, capable of performing tasks once reserved for human professionals. In the realm of pharmacy, AI is promising to streamline process, enhance accuracy, and improve patient outcomes. But with these promises come questions and concerns. What does the future hold for pharmacists in a world where algorithms can dispense medication, manage inventories, and even provide consultations? How will this impact the patient-pharmacist relationship, build on trust and personalized care? In this video, we'll discuss ethical and practical considerations surrounding AI's integration into pharmacy practice and what does it mean for the future of pharmacy. So whether you're a healthcare professional adapting to these changes or simply intrigued by the intersection of AI and healthcare, you're in the right place. Join us as we discuss where artificial intelligence meets pharmacy.
So since last we spoke has been a while, but we got back again, huh?
Yes.
Okay, and we're talking today over a subject we decided, correct?
We decided we're going to talk about AI, artificial intelligence in pharmacy. So we choose opposing arguments. I don't think AI is going to take over pharmacy and pharmacist jobs, and your arguments will be you will think that AI will replace pharmacist jobs.
Well, yeah, we're gonna talk about that. So it's not gonna fully. I don't think AI can replace any jobs totally, but definitely can help and and reduce the amount of people that we need for many professions, I believe.
I think it will replace some professions. I think it will replace a lot of professions regarding to it, but some of them they can't replace.
I think still it needs to have. It will replace, yes, but not fully replaceable because it still have to have that human touch and care and emotional involved into it. And for the pharmacy, I think we will stick to the pharmacy subject. I think would be a little bit easier for us to keep going and be within what we're going to talk. But with a pharmacy, I think it will definitely enhance the efficiency, accuracy, and also it will help with personalized care, I believe. But that being said, many pharmacist jobs gonna be slashed, cut back. So instead of needing like 2, 3 pharmacists to have in a pharmacy, you will need probably one pharmacist, and with the help of an AI, they can come and then can talk to a robot, and they can yell at the robot. They have no emotion, so it'll be fine too, you know.
I think, well, the thing is, right now, a lot of places they are cutting pharmacist jobs. They are having one pharmacist working it without even AI. A lot of pharmacists are doing that already, and they're making a lot of mistakes. Well, the AI will augment them and help them in doing a smoother transition or like an easier job in that instance. But this is still, I think it just, as long as there's human interactions, it's hard to place a robot with a pharmacist in any profession itself, like nursing, you can't, doctors can't.
Especially in healthcare. Nursing for sure they cannot because it's totally, it's very, I think it's a very personalized and very caring and nurturing kind of profession. So it'll be very hard to replace that. But I think going back to see the current role of the pharmacist, like traditional role of the pharmacist, what they usually do, and we're talking about retail setting, dispense medication, consults with patients, they manage healthcare and medication plans. So on this regard, I think AI can actually step up and help quite a bit. And I'm saying still not gonna replace totally, like having no pharmacists at all whatsoever. But I think it will help or to augment the amount of work they do. And like we're talking about having, instead of having like 3, 4 pharmacists, you can have one pharmacist probably for a store, and then have most of the other things AI taking care of.
But if you talk about that instance, shouldn't AI will help then instead of one pharmacist per store, they can have one pharmacist per region then? They can have one pharmacist in 2 stores, if that's the scenario you're talking about.
No, I don't think so, because what we face the most challenges right now as a pharmacist in healthcare in a retail setting, high volume of patients. We do a risk of human error and limited time for personalized care. So we have no time for these. So basically, with the AI, with the help of AI, we can we go more to automation system. And you know, the AI, not many people know, but we used to AI been around pharmacy for a long time. We do automation system. We use all the time a robot, Uyama machine, whatever they call it, I forgot now. Uyama.
You know
Somebody
myself,
has
yeah.
Uyama. Yes. And so they had like tracks, they had the bubble packs they make, like all the stuff they do. So now with more like enhanced AI, they can have even like consultation. They can have when they like, for example, how I vision for the future would be a station. So patient goes, and then probably they have a scan. They scan their ID or their insurance card or something, and then that what he's supposed to pick up will spill. He'll pick it up, and then every single medication, or one by one, will give them to him, and we'll go over it. It will ask, "Do you want to go over this medication?" And if the patient says yes, and AI will go like, "This medication you can take 1-2 times a day," blah blah blah, and explains everything. But if he doesn't want all that information, he can stop if he can ask questions about certain things that he has that concerns him. So it'll be almost like with a human pharmacist where they ask, okay, do you have any consultations? You know, a tech asks and then they call the pharmacist. In this scenario, the machine, the AI can tell them those. I think that is one thing how I can help on that regard to the to the retail pharmacy.
Well, in that regards, you know how Amazon has taken over like box retail stores, everything's home delivery. I feel like pharmacy will be delivered to a person's house, and they either go to like on a computer or do a Zoom call with a pharmacist or somebody that will explain everything to them.
Yeah, I think if we do like a that we're talking about like a but I think people still like to go to the store or to the pharmacy and pick up medications. I know Amazon got very big with that and like delivery, home delivery, and all that. But I think there are a lot of people who need that medication right now and right then. You know, like when they go to the
Well,
ER, they
Amazon has like a 1 day delivery, like the same day delivery. And you know how when you have a child like crying sick, you're not able to leave the child home and we'll bring the child out to get the medication. It's gonna like cut through a lot of things that I think pharmacist interaction would be less and less in that instance.
Well, I think it will help more. The interaction will be more like personalized. So basically, now instead of doing a high volume, when you really don't have time to talk to anybody, like you have like 5 seconds to pay attention to someone, and you'll be the lucky one. You'll have more time to talk to patients because most of the other stuff in the background is being done by the AI or automation. So like filling, for example, like a bunch of like phone calls, refilling, like a consultation that are like very things that they can get the answer with a machine. So I think this will help a lot. Still, we'll have some more pharmacists, of course. Like all I think is like you be able to do more things that you're trained to do as a pharmacist instead of just being a cutting pills and putting in a bottle.
Because I think we're trained to consult with the physician and also the patient to do more interaction in a personal level. I think so in that instance, I believe that AI in that when we have human interactions with human itself, I don't think AI will ever replace a pharmacist's job. Because
Like,
it's
well,
always the last step for dispensing the medication to the patient. It's like almost
that's
insurance too.
exactly, that's very true. But then AI can help with other things that can improve the healthcare in general, like with other professions too in the healthcare area. So most of the AI, what they what how I see it in the future, what I think would be with diagnostic and imaging analysis. So the same thing will be with the prescriptions. When the provider sends a prescription, now we have to look at it and to do all the writing, what they to guess and like figure out what he wants to say. That stuff will be cut off. The AI will do all that. You have nothing to do with that part. They can use the OCR system that can read actually prescription, and they are very good with that. and then transcribe for you everything. So you as a pharmacist, you don't have even to check everything. On the end, last minute, you will be able to check. That's what I'm saying. It will be like one pharmacist per store, and it will be really don't matter how big of the volume the store has, because the AI does all the robust things. And then you as a pharmacist, you check the main things, what are most important. Then so AI doesn't know everything. I mean, of course, they're gonna have like errors sometimes and missing, and so we can use our judgment and see that part, that we can make that decision based on like when it's a gray area kind of thing. And so that's why I'm saying like the other stuff, repetitive stuff, AI will take care of everything. And I really think that when you go to pick up prescription, if they can still ask to speak to a pharmacist, but other than that, they can just bypass that totally and then just get the medication and will tell what they want to ask for and will give the answer.
But
so
in that instance, you saying that if the patient comes and pick it up, they have an option to speak to a pharmacist. That's the same as going as if the patient want to speak to a pharmacist, they could just pick up the phone or call whatever hotline online and then speak to a pharmacist. So the pharmacists don't have to be in a store actually.
well, that is it cannot be in the store, but then if the store the patient has a question at the time right there when they pick up medication. I think they tried other retailers tried before that. It's not something new when they have a place without a pharmacist or they have own pharmacist and everything else is remotely done. I think Walgreens is pioneer on that when they tried in Florida and they had like these hubs.
Yes.
Where they do like central calls and stuff when they answer the phones and stuff. But I don't think that really works. And you know, Lara, to be honest with you, when it comes to AI in regards of calling and having interaction, we tried that like what 10 years ago already with you know, having everything automated. So you could call somebody, you call for something, you never can speak to a patient, to a person on a customer service. You just talk to the machine, and you know how that end up. Never went anywhere. So then they brought up and they removed that totally, and then I can talk to. And they were actually advertising it with us. You can talk to a real person because it's different. You have that interaction with a person.
Well, the thing is, the AI is so good. But do you ever have those calls that people talk to you? They're AIs. Like sometimes they even chat boxes. They're like so realistic. You can't tell if they're AI or not, or if it's actually human. They're becoming, even with voice recognition or like the voices itself, they're able to replicate like human voices, human interactions, and they could have empathy in the future. And it's hard to tell what is real, what's not real anymore.
That's very true. So to be honest with you, I don't even know if that is Phil I'm talking to or not right now.
Exactly. There's some.
You look very young.
There's some what's called YouTube videos that to advertise and say, "Oh, this is not human. This is AI generated," and say this whole ad is AI generated, and this person speaking, his mouth is just moving, but it's the AI's voice that's over it and laughing, just saying stuff, which is crazy. So I think AI is going to take over like a lot of things. I think the human era of making these AIs or algorithm or like new drugs that comes out is the one that's preventing it from pharmacists becoming totally AI. That's the only thing.
Well, that you're actually helping me a lot because I'm supposed to say that the AI is gonna take over everything, and you're like supporting that. Thanks, Phil.
I feel like we're going the opposite way. You're the one to say that. I feel like our stance are reversed. Research and what we believe in is like totally different things. That's what I feel like. I feel like the more I'm talking to you, I'm switching my stance, but like you agree that we do this stance, like whatever stance we have. So the argument that we're having is like the opposite of what we're supposed to have. You're helping with my argument, I'm helping with your argument.
That's the reason I was thinking, like, is this Phil I'm talking to? Or is this like an AI I'm talking to?
See, there'd be no difference anymore. Because right now, a lot of times, like, you know, when your mouth moves, people would just fill it in with words, which is crazy.
Yeah. So I think that when it comes to most of it, it will be like more to the workflow management, like clinical trials when it comes to accelerated drug discoveries. AI is gonna replace, but I still strongly believe that human touch we have to have a human touch at least. You know, I really don't see having a whole pharmacy without a pharmacist.
But let me ask you, what's a human touch? Like right now, the AI.
so for, like right now, for example, when you use AI on something, you still have to go over it and see what it's done. Like you ask him to do whatever, you do a code, you do a program, do something, you still have to check it. Most of the time, what a lot of people are using it is to like when they have a problem, cannot solve it, they go to AI and they says, okay, can you check this code? What's wrong with this code? Or when you write something, write an email or like a paper or something, you ask that little bit like a finite touch to have it, just to see, make sure that everything is correct. Anytime I use AI, most of the time when I use it, I found a lot of mistakes and a lot of things that I don't want to say like that. I don't want to be like that. And so that's what I'm saying. Like it still has to have, like even with the prescription, when it's everything filled, it could be accurate 100%, but still it could have like a mistake, could be a mistake made by like a machine mistake, and you have to check again that person is actually who it is, and the final go kind of thing, And so, or because AI, I mean, it is made by human, and anything humans make, they can make a mistake. So they can have, that could be some kind of a misleading, like something when the patient comes in, it gets mixed with somebody else. Those are things that I think still needs to have a pharmacist. And then when prescription is filled in retail, the pharmacist will have and says, okay, Mr. Smith, this is your amoxicillin, and you're gonna take 2 times a day. And he'll be like, oh no, amoxicillin? I don't know about amoxicillin. I thought I'm gonna have something else. And AI cannot, like, these are things that kind of, and you see in a phase 2, they're good, but I don't think would never be to the point that can totally replace that. We don't need them. We don't need humans anymore,
Well, see,
or pharmacists in our case.
so the thing is, like how I see it is that, because you know how when they did do like they did the study saying that when AIs were detecting during radiology all these images, the AIs were able to detect certain things that doctors were not able to detect or know due to the
Well,
algorithm that.
yes, but that is
So
based on a data, right? Like
yes,
errors
so
through
what
how
I'm trying to say is that if they remove like human component throughout the whole process, AI has a better chance of hitting it higher, less mistake than human. If AI were able to diagnose, because right now doctors are still diagnosing. If you take out doctors out of diagnosing, if they have all the technologies that AI could diagnose, and from that diagnosis, able to have a plan and also implement the medication, it goes straight to the pharmacy, and that pharmacist AI will able to dispense it. So there's no human interactions. So the percentage of higher a correct diagnosis, because right now there's human error in every mistake. That's why they
true.
need a human to correct the human error. If there's
So
no
what do we need?
error,
Based according to you, what should we do? Go to Hawaii and lay down on the beach as a humans?
that's what's gonna happen. I mean, a lot of people get a massive layoff, and all the humans, they need to be like right now, we're creating content. That's the only thing we can do anymore. We can't compete with AI. They calculate faster. They have quantum computing. Everything's gonna be faster. Everything's gonna be more accurate, less human mistakes. You kept saying like human mistakes. Like if AI could have their own algorithm, have their own code input by themselves instead of having human mistakes into it, then it flows, the percentage of error is less. As long as humans able to put in the code, there will be always a human mistake or human error, and they need another human to correct it. I think that's the whole issue. If they have AI from the beginning, if the lower jobs are replaced by AI, and sooner or later the higher jobs get replaced, then the whole error will be be seamless.
Well, that is ethical is not ethical, and it would not happen. It would be almost like with Doll the sheep. Remember, in
Yes.
1980s, similar thing. Because the thing is that not because uh, I still think AI is gonna help a lot on a lot of things, but I don't think it will replace humans totally in general. I mean, I know that you're against that probably too in one one way or the other, but I really don't think that it's gonna happen. It's just it can help along the way, like with quantum data automation set with genetic profiles, like you're talking about. It can detect more things, like in larger quantity, but still you have to have that personal medicine and patient care. That's why
Well,
I
Well, look at the sci-fi movies. Some sci-fi movies in outer space, they just sit on a table and everything's diagnosed and they just inject themselves and that's it. And they continue with the mission. That's like seamless. Like the AI diagnosed the problem, fixed the problem, and then they just go back. So we continue doing other stuff regarding to it. Like, look at American roads right now. Our American roads is so messed up
Yeah.
that we need to have constant constructions because we want to have jobs. That's what's going to happen in the future because human beings want to have jobs. So they do this to have messed up roads. So we continue having, like, in a human perspective or AI perspective, it's meaningless jobs that we're going to have in the future. That's what we're going to
Yeah.
do. We fight for meaningless jobs. Like right now, we fight for coal miners, even though a lot of coal miners die in the mine. But we still want that job because they need to do something. That's what's going to happen. AIs can replace almost everything in the future, and we're still holding on to like something that's meaningless for us to continue living, have a purpose or do something. That's what's happening. That's what your
I think
argument sounds like.
you have those reversed though. I think we should or we will have those dangerous jobs and those things that are not healthy or health hazardous jobs. Have the AI do that, like make small robots and like for the even for the roads too, so people don't have to do that anymore. And so we can concentrate more on the higher level of overseeing AI. Like for example, with AI, you have a lot of ethical considerations you have to take into account, like like laws, like a privacy laws that are like and then we have other thing that we have with that. It's the privacy laws are very important, and AI doesn't you cannot take those into account. This is something that's what I'm saying. Like personal touch, AI, it's almost like it's very hard for them to get to have that even they have feelings and everything, still cannot be a human, you know.
Well, so I mean, it's go back to the definition. What's human then? Is human making mistakes? Is that human, or does it have like empathy, or is it? Because sometimes you
Yeah,
could teach AI
the
to have
combination,
empathy.
the combination of everything what makes you human. Human is not perfect. Human can make mistakes, but can realize when they makes a mistake. Human has empathy. Human has a feeling. Those are not those things that AI cannot really have. You can have everything train them, but still, when it comes to make the judgment, we have a gray area. It will AI is a AI is made by humans. Mathematically, it does everything, calculates statistically what is probable cause to do something, and those equations takes them into account and it decides what to do. With us as a human, of course, we cannot do in a large scale what AI does. But when it comes to make those decisions in a gray area, I don't think AI ever cannot be able to replace a human being.
Well, remember the whole Turing question? Was it Turing questions? It was like, is this a robot or is this human? Do you
No, I don't
remember?
know.
There's a there's
No,
a there's a person that invented the computer, the first computing system. He asks these questions like, if you ask like a set of people, can you differentiate if it's a robot or is it like a human? Like if you ask
mm-hmm.
them questions, like can you tell if that's a human or that's a robot? Because right now AI is so good, we can't even tell if that's a human or that's a robot. So in that instance, when we can differentiate between AI and human, then AI is actually taking over a lot of different things. They're more noticeable, they're more caring. If we could program AI to be more noticeable, more caring about your feelings and everything, humans can be replaced. Humans can't even tell another human from apart from a robot or AI. That's how good
Well,
they.
if you have it close, you can touch them and always know if it's a robot or AI. You just have to know where to touch them.
But right now with the whole metaverse, it's like we can't tell anymore.
You have to
Nobody,
ask,
nobody
are you
goes
he or
out.
she?
Well, if you touch someone, you're gonna get sexually assaulted. Then you gotta go to jail. So right now, you cannot touch everybody. You cannot
It
sniff
depends who you are.
everybody unless you're the
Depends who you are.
president.
If
That
you're
you're gonna
higher
sniff
up,
people. So
if you're
it's
very
hard. Like people can't even touch people. People are scared to touch someone now because they're gonna scared of sexual assault. If you just touch or you just bump to someone, people's like, "Oh, this is sexual assault. This is sexual harassment." So nobody want to touch anybody anymore because of this law. So
I
it's perfect. It fits perfectly into like AI is gonna take over everything.
and yeah, that is I yeah, I mean I really see AI as a as a tool to enhance our professional or profession, like pharmaceutical profession and patient care. But I do know, even though I was the one who we were supposed to, like, it doesn't really matter, we're talking in general together. But I really think we're gonna have it as a tool. It's gonna help us a lot, but I don't see it being totally being able to replace a pharmacist. That's where on the end, that's where I would go. And those are the arguments that we're talking about, like, that it needs to have a little bit more than just algorithms to solve the problem.
Well, I feel like I don't think the technology is there, but I think AI is going to replace everything. It's going to replace pharmacists. Pharmacist was a byproduct of a doctor. Remember back then, there's no pharmacist like a century ago. Well, like maybe there is pharmacist, but like a 1,000 years ago, there's no pharmacist. It's just that it was a doctor's job to dispense
There wasn't,
medication.
there was not a doctor 1,000 years ago either. There were some grandmas trying to help
Yes,
us.
they have it. Then they have someone specializing in like diagnosis and giving medication. He's doing both jobs, and then out of nowhere, pharmacy just grew out of like dispensing from a doctor.
No, man. Pharmacist is actually, if you look, they go hand to hand with medical too, because
Yes, it
the
goes hand
medication
in
will
hand, but it used to be way back then. It just be one person that's doing it. They never see a pharmacist following a doctor dispensing medication during the medieval
Well,
time.
it was different setup. The pharmacist made medication, but had no idea what you have to diagnose and what the person is. But they know, like, okay, you need to treat this one. We can make this medication with this, with this. We can put it together and help it. And give them to them.
Yeah,
Nowadays is different because we're going more, like you're talking about. We're going more like to the healthcare team, and we're becoming more like under one umbrella as a old, like a doctors, patient, what do they call the other one, the PIs, uh, physician assistant, PAs.
PA, PTs, yeah. So
You have nursing practitioners too, and NPs and all this stuff, and they all actually caring for the patients, and so like a clinical pharmacist. I
yeah,
still believe clinical pharmacists, like when you look at it, if you do like dosing and things like that, those are within pharmacist
yeah,
boundaries.
they are, but
Yeah,
if
but a
if
lot
the
of stuff you
calculation,
have you
if you
say
do
it
the
again.
calculations about like the clearance and how much to dispense, that's AI could just do that, no?
It can and cannot do, because when you have like the trough levels and things like that, you need to take lots of things into account that AI cannot calculate those without having all those done, and you cannot. How are you gonna have it? If the way you're saying, we should have one that we don't have humans anymore. We have robots and robots, and then there will be no place for one or the other. Then will be all robot to robot to the AI, and then the world will be over, it will be gone, and then the robot will take over. But as long as the human is not be there, it's not be very hard that interaction to have that connection between humans and robots to have all those done.
Yeah, because humans they'd be like, I don't get this, and then robots are like, you need to eat this.
And you have to remember who made AI.
Well, it's not just one person, it's just like a collective
Oh
effort
yeah,
to make AI.
yeah.
I think
It is
people
it's collective, but humans, right? You didn't come from outer space,
no.
so
Well, that means the question is that who made humans? Is it God? Is it nature? Is it humans? Like what
we have
happened?
to
We
talk
control,
about
we try to be God now. So
other theory we have to make for that. That's a big subject because I've been dealing for it for a while now.
well, the scary thought is like even the pharmacist, there's like certain algorithms, like oh, if the Stewart antibiotic that we get every year, a little booklet of what's could treat it, antibiotic. It's like an algorithm already. Even a lot of stuff that we see, all the calculations is an algorithm. It's like it could bypass everything with this AI.
Yeah, I mean that's what I'm saying. We can use totally we can use AI to calculate. That is based on a data science. Because what you do when with a flu season too, with antibiotics, you see what was the more resistance, what we're thinking to is gonna go towards this population, and those AI can help us give us more like a clear picture what would be based on statistic, what's most likely is gonna happen in the future what flu sting we can have and get prepared for it. But when it comes to treatment, I think still we need to have a human being to check and say, okay, we have this person has this, but this a little bit of that, and we still make that decision that is that AI won't be ever able to capable of doing it.
Well, I guess you're right. I mean, if it's, I guess 98% of the work AI could do, just 2% of like the future that the AI can predict. Human will step in and it's like, hey, I could do that job.
I can take this.
I could do this. There's no algorithm for this. I could do this. That's a 2%. That's why humans should exist in the field.
And then for example, we have patients that are, you have to decide among patients who has to go and who has not. As an AI, it will take into account only part that what it thinks will be good, like chances, but then it doesn't know the backstory. Like that is the daughter. Who is that daughter, or who is that son of? If you are like, it's your best friend's son.
I've been on like a first responder. I work for like ski patrol. So there's triage happening. Even a nurse, when they take it in from the ER, they triage which person, like you have breathing issues, you go first. Like there's certain things that they triage to see what's going on. So the same thing, AI could just triage the whole thing. Like, you know how they kept saying like, to be a good doctor, you need to see the facts as it is. You can't have empathy in it or something like that.
That is true, but then you have, for example, your buddy's kid is there. So when you triage, if the AI is taking over, it will be like, okay, it doesn't know your buddy's kid and will go. It doesn't care for it. But
It'd be
if you're
fair.
there,
It would be fair.
forget about fairness, Phil. Life is not fair.
No one's justice, no one fair.
Life is not fair. This world is a mess, my friend. Look around.
So that's the reason why we should have AI. So it would be like nepotism and hierarchy, aristocrat, and the oligarchy will go first, and all the rest will just have to wait.
Is that have to wait? Next. No, but it is just to wrap up on this topic. I think we can talk that AI, or again, I'm saying the same thing. I didn't change anything. I think AI will be a tool to augment what a human being needs to do. So together will be like a hybrid that we can be better for ourselves to help other human beings. I do not ever think that AI or robots will replace totally human race. We're talking about the pharmacy in this section, but I'm talking about in general.
I think it would. I think it would in the future replace like a lot of things.
And what would happen with the humans, though?
See, that's
how would you do? How would you allow as a human things like that to happen? Because in order for that to happen, you have to think that it's poverty is not be up the roof, and if people have no jobs or what they can do other thing. If AI does most of the jobs what they do right now, what humans would do if they have nothing to do? They just reproduce.
Well, we'll look at it. I mean, in the past, there's certain things that humans do, like human don't do anymore.
Like what?
Like we like manually harvest food, or we like manually calculate certain things by hands, or bookkeeping. Like you used to do a lot of things. Oh, we used to like do a lot of like we used to whale hunt for oil. We stopped doing that. We used to have a lot of horses. We don't have cars anymore.
Yeah, well, that is very true. But that's not taking over though. It's augmenting. So it's helping.
It's helping, right? But right now, with a lot of things, I feel like as a species itself, you know how this is like back in the caveman era, we have a smarter brain, whatever case might be, we evolved better and we took over a lot of like different species. So the next species of evolution, it's AI robots, it's cyborg. It just makes perfect sense. You know how we go to a place, we just trash the whole environment, we transform the whole environment to fit our needs. We just destroy like a lot of things back and forth. We go into it. We pollute the water, we pollute the air. We're having like breathing issues. We have climate issues now. We're just having a lot of issues with what we do. We're destroying whatever we touch. And then AI could be the next one that's like we have a bad atmosphere or like some horrible thing, AI will still survive. If a comet falls down, destroys like a lot of humanity, make it inhabitable for us, AI will still survive. I think that will be the next species to like survive in this evolution. But look at the dinosaurs, got wiped out. All these different animal species. What is it? Just like like a huge amount of species get destroyed, extinct in this world. You think human beings will be the exceptions to this?
So, Dr. Phil, you're introducing AI as a species now, I believe.
It will transform. It's like to next evolutions where it will survive further than human beings. If we do it correctly, that the mark that we leave behind, that would be like us being God to next species or next evolutions of them surviving. We made you to continue surviving. Like for us, we don't even know what we're doing anymore. We're destroying everything we touch. We try to fix stuff. We just kept arguing with ourselves. We don't make right decisions anymore. We made it based on feelings, which had nothing to do with if the world survive or not, if humans survive or not. We don't base anything on that anymore. Like global, like climate change and stuff. Some people arguing like climate change is not real. It's just normal pattern of humans. Some people saying that it is. The more higher temperature goes, human being, our food, everything will be wiped out. So we're the stand. We're still arguing about it while it's still happening. We were just destroying ourselves regarding to it. Even nuclear weapons. If one person's like, oh yeah, like I almost want to press the button for fun, see what happens. What about the human? Just for fun. Plus that feeling like, hey, we should do something new. Or I love Earth too much. Or whatever case might be. I think this human thing could either make us or break us. And it still has a chance. But AIs will make, if we give them the right algorithm, will be survival. Put us in cages, put us in zoos, put humans in zoos. What will we do to other species? We don't live well with other species.
Put us to zoos. That's right. Well, yeah, well, that's a good. It's another thing we can talk about in general. What can do, but as far as for this topic, what we have to talk is that that's what we. I still believe that AI is going to help a lot, but stays with these. I think it reached the maximum what we're gonna do with AI. I don't think they're gonna go any further than this.
I hope so. I mean, other big,
Yeah, I really don't.
but other smart people like Elon Musk thinks that AI will take over and we need to do other things with it. So I'm not too
I
sure.
think you're gonna. I think it's gonna turn on.
Yeah. So I think this is it. I think this is our closing. Mine's gonna turn off too.
Yeah, I think it's a for some reason something came up on my screen. I cannot move it.
It says Dr. Doni.
But yeah, so just
So
I have no idea.
I guess
What
we just
something
close
came
it
up on the
off
thing, but
with the conclusion.
yes, with the conclusion, let's like I said before, to wrap it up. What I think is gonna help is gonna be a part of the human being or the pharmacist in general for pharmacy. Is gonna help a lot. Probably a lot of we're gonna see some job losses during this process, but definitely is not going to replace the pharmacist.
Well, I talked to somebody before. They said that this programmer saying that it could replace any job. I was like, I told him like legally you cannot replace a pharmacist unless they change the law regarding to it. And then when that time comes, when the law change, I think things gonna happen. If the AIs keep like improving the way it's improving, it's gonna be is improving exponentially. So it can hopefully it doesn't happen in our lifetime, but it can really fast change a lot of people's lives and replace a lot of people.
What we can talk about the next subject or next time we can talk about what do you think? Pick something. You have something in mind? Whoever sees this video, they can see what comes next. We can talk about AI evolution in worldwide, and then we can talk about that with you talking about the laws and everything, and we can argue about that, talk about that a little bit. What do you think?
Just talk about pharmacy law. That is so confusing.
Pharmacy law?
Yeah.
Okay.
You know how we had each state has a different law for pharmacy?
Yeah. Okay. Let's talk about pharmacy law.
Okay.
Okay. So now this thing turns off. Can you stop recording now?